So some of the lessons learned from that data were that we should continue to develop and outreach to underrepresented communities, because a lot of people felt that there weren't a lot of consumers there wasn't that much community input, which again, as we saw, it was, while 21 is an okay number, it's not as big of a number that you would want. So focusing on, we can make sure that we are able to get that outreach together, making sure that all aspects are adequately prepared. Again, technical things just to make sure that people feel as if the information is prepared and that they're able to really understand it and digest it so they can take it and possibly bring in new people. Continue to improve accessibility. We did have a couple comments about, the handouts weren't as easy to read, or, they had trouble with understanding this part of the presentation. So always continuing to work to make sure that the information is accessible, and then simplify and increase ways that people can stay in touch and get involved, because again, we want to increase as much participation as possible. So some of my improvements and suggestions, just from me looking on the outside and me analyzing what everybody said, I wanted to start out with a pro first, because it was something that was noticed across the board. Was the time management was received really well with the people that took the survey. They said the time management, for the most part, was on point. And from the other surveys, you could see that it had improved, because I didn't see a single comment about somebody saying that it didn't have enough time, or they weren't able to fully grasp because there wasn't enough time. And then promotion and outreach, again, a lot of people said that there weren't as many consumers as they thought it should be. So, maybe focusing on advertisement or getting the word around, just to make sure that we're getting members of the community, because we want to have as many people in the community as possible, so we're able to get the best data possible. And this was what I wanted to talk about earlier. We had a point about somebody said that they were able to take away something from the northwestern region of PA. And I wanted to know that, because if you have that positive comment, but then on the other end, you have somebody saying, well, there's not a lot of people here. Well, for me, looking at it, it might be a missed opportunity, because they could have got some very useful information as noted, but since there wasn't a lot of people here, it might have been the fact that, we don't have as many people, so not as many people are walking away with the information that they need. And then just displaying a sense of outreach to all communities, developing and promoting a specific plan for HIV prevention when it comes to people with disabilities and intersections with aging. As you saw with the demographics of the age graph, it was an older population, so you want to make sure that you're addressing all their needs and making sure that their concerns are met. And then another thing I wanted to note was that I had a specific part at the end of my survey where if I asked the person if they needed accommodations, how accommodating was the meeting to their needs. And another pro that I wanted to list is that all of the people that answered the question, it was about 4 people, said that the meeting at least somewhat met their needs. So that was, again, another plus. And then just as I've been repeating, you might get annoyed when we say this, but just making sure that you're performing outreach and getting to the communities, because again, you want to have as much community representation as possible.
Quincy, you're doing a great job. I put water here for you. Because I know.
You see me.
I've been there. I know. So please help yourself. I'm just curious if you have any suggestions. I don't want to throw you off the train, but moving forward on how we can specifically ask consumers who actually do show up, what their thoughts on why they came, or if we can glean out of that how to more effectively target. Right.
All right, so I will definitely get that water. This nigga, because I need it. So one of the things that we did in preparation for the survey is that I actually looked over a couple of documents in relation to survey making, especially when it came to community survey outreach. So I definitely agree with the point of even like just as simple as putting in a question for the next surveyor. Why did you come? What drew you in? So you can start to get more community feedback. So for me personally, because that is a great point that I wish I would have thought of. But for me, it's as simple as, maybe putting a question on the survey that can say, you know, what drew you in? Was it somebody that recommended the meeting to you? And then whenever you see somebody that came to the meeting, or you see somebody that you think could come to the meeting, you ask, you know, what could make you come here? Because I know one of the key things we talk about in the Pitt Public Health Campus, you have to meet people where they're at. So if you're able to take a person where they're at and sort of draw them into you, I think that that would maximize the best result possible in making sure that you get the community outreach that you want and that you need to make sure that we're serving the communities as best as possible. And then, just for a final point, I had noted that the data, while it wasn't all positive, it was all very uniform. So again, it gives a more clear path on how to address the community needs and where to meet the community at. So,
we have a question.
Susan Thompson has a question.
Susan, do you have a question?
Yes, thank you so much for calling on me. I thought this was just wonderful. I think these town meetings are great. One question I would ask the participants is, can you suggest some agency or person we should be recruiting from? In other words, it doesn't have to be worded that way, but ask people for additional recruitment ideas.
I definitely, I thank you for saying that. I'm definitely taking that into note. I do think that that is something important to know, especially since that they are in the community, so they could possibly lead you to somebody who is influential in the community that you could also use to integrate into the program and make sure that we're still addressing those community needs. So, I'm sorry.
One of the things I think we tend to do with like town hall meetings, we always say, well, we want people living with HIV to come. But just like our HPG meetings should be reflective of the epidemic throughout Pennsylvania, I feel like we should almost have an expectation of town hall meetings. Like, if we're having this in Erie, what is the distribution of people living with HIV in Erie? What does that population look like? And can we get our town hall to kind of mimic that? And that's almost like a measure of success, right? I just think almost like what we did with aging, like, oh, we need to address aging, but what do we mean by that? So when we say we just want people living with HIV to attend, but who are those people in that given jurisdiction, and how do we, engage them? Maybe they're not an engageable population, depending on access to work. Like many times we always will say we want unaffiliated people, but most of the time, people that attend these meetings are affiliated, meaning they're in Ryan White Services. So who are those people in Ryan White Services that are living with HIV, and how do we approach them? I think we just say, well, we want people with HIV. I think we need to be a little bit more targeted in who we're trying to recruit.
I definitely agree with that, and again, that is something I wasn't even thinking about, but just like taking into context, the people that live in the northwestern part of PA, I think that was a great point, because you're not going to see the same people in the northwestern part of PA that you might see in the Philadelphia or Pittsburgh, so you want to make sure that while you're being broad, you're focusing on who you really need to address so you can get the best results possible. So thank you for mentioning that.
Quincy? Oh,
Great.
Great job. With the drop from 80 to 60 in your engagement, along with the difficulty in understanding the handouts, I'm wondering if you have any suggestions as to how we could do that better. And to Sharita, I think it's great that we could look at cultural aspects of where we're meeting people in terms of their town hall.
Right. So to that point, we actually did have a comment that had stated it not only reinforced that they agreed with the fact that the discussions in the town halls were important, but they also had stated that, if you get more people to come, that you could then use that as an understanding to gauge the cultural awareness of the community and also sort of gain a spatial awareness of the space that you're at. But I definitely agree with the cultural aspect because I feel like sometimes even the questions might be too broad just to address a specific community, which is why where the questions that I tried to change so they could specify that specific part of the town hall, especially with like the accessibility questions, because that is something to make note that you're hearing from the feedback, so I do agree with that.
Thank you. If we're looking at how we approach our communication, and I'm hearing that we're not reaching people with the language we're using, how can we improve on that? It seems like that is going to be directly related to each person is going to share with how many people they know that they attended and what their experience was. So if they're not able to be engaged and be able to easily read what we're providing, we're not really doing our job. So I'm kind of wondering, if we could maybe review the kinds of words we're using. Is it too big?
I understand.
Our terminology, is it too clinical? Does that make sense?
Yeah, I completely understand what you're saying. To your point, when I was looking at previous surveys for the discussion feedback, a couple people have noted that whenever it came to terms like the HCPC, that they didn't understand what it meant, with the acronyms or, sometimes just big words that you use to not sound unprofessional, but because it might be the professional term. So, you have to say in possibly through the use of just training on how to speak to people on a personal level, because I know even with some of the things I do at school, whenever I'm giving back information, we sort of run down the information and then condense it into a statement that could be more understood by the general population. So whenever you ask questions of how to improve, I think a big thing that comes to mind is just training on how to talk to people and understanding not their competence, but what they understand from what you're saying, and sort of meeting them where they're at when it comes to the terminology barrier whenever you're talking about this aspect of the field, because I do understand especially what you mean when it comes to terminology, because even when I was sitting back there, but I did get a little scrambled when I was like, but I completely understand what you're saying. So thank you.
We got one more person.
Hi, Quincy, this was so informative. You did a really good job. Thank you for all your hard work on this. I do have a question about whether we know how many community members were attending in person versus virtual.
I do not know the exact number, but there is all the data is compiled on the Excel sheet, and it did say if they filled it out like through QR code or like link. So I can see if we're able to get you that specific information. But just from when I was on the meeting, I would say maybe it was about 20 to 15 people that I saw virtually, because I know the room was a bit crowded how it was now. But specifically, I don't know that off the top of my head.
Yeah, I'm curious if engagement in the presentations were affected by whether somebody was attending virtually versus in person. Are we doing a good job engaging people who are attending virtually? Are we giving them space to talk? Do they feel that they are able to pay attention to the presentations? So I'm curious if that affects anything, if we could be doing a better job. Also, I guess if somebody was attending, a community member was attending virtually, what zip code are they living in? If they are attending virtually within Erie, why are they struggling to get there? Should we be doing it at a different time? Do they need assistance with transportation? And I know the new policy we have makes it a little bit harder for that. So I guess those are my questions for the next time we go to the town halls, maybe looking at zip code and trying to figure out who's attending, which community members specifically are attending in person versus virtually, just so that we can continue trying to engage people virtually, which is a difficult thing, and we're trying really hard to do it here for HPJ as well. So.
Right. I do definitely agree with the virtual part.
All right, up to you.
But when it comes to specifically addressing the virtual needs, I know that looking from previous data, there was sort of to what you're saying, there was sort of a barrier when it came to virtual communication, because you can have like technological issues, you can have Wi-Fi issues, and then you can just have that. Even for me, whenever we were completely virtual, I did like whenever you're on the computer for that long, you tend to lose focus just a bit. So I definitely think implementation of that, I could, again, for me, it would be as easy as like, putting in a survey. And while the question was, how engaged were you? Whenever I was creating the survey, there was an option where you could have somebody selected, and only if they had selected a certain option, then they could answer another question. So even as easy as like putting sort of sub box where they ask, did you fill this out virtually or in person or through a QR code, and then asking the question again, just to gauge that feedback, because I do agree, because that is very important feedback, and we are all, like, as a world, just sort of embracing this new hybrid world together, so I do agree with that. Thank you for that.
Quincy, thank you. Couple things that I want to mention. This town hall, before this one,